During your operation, doctors made a cut in your body, which they used to access and remove or repair a damaged part of your body. A special thread was used to close the wound, which was then covered in a fabric called a dressing. Dressings help your wound heal. Sometimes your wounds may get infected. This happens when microbes, single-celled organisms that your eyes cannot see, enter the wound from your surroundings. An infection can also happen when microbes from one part of your body move to another. For example, if your gut is punctured, microbes from there may move to your bloodstream. Infections can happen at any time between surgery and your wound healing, in the hospital or at home. It may take a few hours, days, or longer after surgery to see if you've had an infection. An infection can result in complications which can lengthen your hospital stay and increase your hospital bill. It can also delay your return to work. In extreme cases, when infections are not treated, it could lead to death. The earlier infections are detected and treated, the better the chances of your recovery. Therefore, knowing the early signs of an infection is essential so that you know when to seek help. After your operation, it is normal to observe some blood seeping through your dressing. However, this should decrease significantly or stop altogether within the first few days. Once your dressing is changed, you should either see no blood or only a minimal amount seeping through. However, when you develop an infection, you may notice a thick, whitish yellow or green liquid seeping from the wound. This may be accompanied by a strong, unpleasant odor. Your wound might also be warm to the touch, reddish, and swollen, and you may feel a worsening of pain. All of these symptoms are usually accompanied by a fever. You may feel sick, have a high body temperature, and chills. When this happens, you need to inform your doctor or community health worker immediately so that you can be given treatment. So, what can you do to prevent an infection after your operation? You need to take the medicines prescribed to you at the right time. Make sure you continue taking them, even if you are feeling better. Rest and eating nutritious food can make your wound heal faster. Avoid smoking and drinking alcohol because this prevents your wound from healing. Refrain from strenuous activities like heavy lifting so that your wound does not reopen. Keep your surroundings clean to prevent infection-causing microbes from entering your wound. And when showering, avoid getting your dressing wet. Finally, if you are told to have your dressing changed at the hospital or health centre, do so.